the harsh reality of COVID, one that many parents are witnessing in their kids.
My one son, he had more problems, with school, with just studying and paying attention. Like my one daughter had a lot of anxiety.
Researchers continue to study the negative impact of the COVID-19 pandemic, and the findings are alarming.
To date, this is the strongest, most convincing evidence for the pandemic's negative impact on youth mental health.
The findings of a recent study which examined pediatric depression and anxiety before and during the pandemic were published recently in a medical journal.
It's the first large-scale study that follows the experience of young people as their depression and anxiety symptoms changed as a result of the pandemic.
The study analyzed more than 50 studies involving more than 40,000 youth from 12 countries.
And what they found is that depression did indeed worsen for kids and teens. Particularly, it worsened for young women, as well as people from high-income backgrounds. Young women may have struggled more due to what we've seen as increased exposure to violence and adversity.
The study also found a number of culprits for increased depression in youth.
The authors note things like increased screen time, increased loneliness, decreased physical activity, school closures and disruptions, canceled extracurricular activities. All of these have been associated with worsened mental health in youths.
Children's Hospital of Michigan was not part of the study, but members of the medical team say they have also noticed increased depression in youth.
Unsurprisingly, we have seen a lot of kids coming into the hospital with acute crises.
So what solutions did the study offer for managing depression in youth?
Good sleep habits, good eating habits, staying connected, physical activity.
Researchers also are sounding the alarm for increased funding to help provide a solution. Many parents say support for mental health was not widely available when kids returned to school after the lockdown.
They didn't seem to offer things when they came back.
I agree with the authors on this. We need more funding for youth mental health and expanded access to services. Our kids' lives really depend on it.
In Southfield, Ingrid Kelly, Fox 2 News.